Good morning, everyone, and welcome to our final day here at Kidney Action Week. We have a great session planned to kick off our last day, so I hope you all are ready to chat about life after a kidney transplant. My name is Mike Spigler, and I am the Vice President of Patient Services and Kidney Disease Education for the American Kidney Fund. And today, I'm happy to be here as we work with our wonderful panelists to learn how to care for a kidney transplant through medicine, testing, healthy eating, lifestyle changes, and more. And here to share all of their great knowledge is our esteemed panel. I'd like to welcome Dr. Silas Norman, Carolyn Feibig, and Crystal Scott. Dr. Norman has been on staff at the University of Michigan since 2002, working as a nephrologist in the transplant program. He helped create a program to transplant HIV-positive individuals and the development of outreach satellite clinics to allow patients greater access to transplant opportunities. Currently, Dr. Norman serves as the medical director of the transplant clinics and the co-medical director of kidney and pancreas transplantation. Carolyn became interested in kidney nutrition while doing her undergrad in nutrition and dietetics. As a registered dietitian, she has worked with people on dialysis and with kidney transplant patients. Additionally, Carolyn volunteers with the American Kidney Fund on many projects, including presenting multiple nutrition education webinars, reviewing the Kidney Health Coach program, major content developer for Kidney Kitchen, and is currently on the inaugural Dietitian Action Group. Crystal is committed to contributing to the fight against kidney disease and regularly speaks to anyone and everyone about the importance of protecting your kidneys. Her kidney journey began suddenly in February of 2012 when she was informed that she was suffering from kidney and heart failure. Crystal was on in-center dialysis for about 3 months before transitioning to peritoneal home dialysis for 6.5 years. She received a deceased donor transplant in December of 2018. So each of these panelists will bring a unique and valuable perspective to caring for your kidney after transplant, and I'm excited to share in this conversation with you all today. Throughout our conversation, we'll be answering your questions, so feel free to go ahead and start and type your questions and comments into the window next to or below the Facebook Live video stream or in the conference platform, and we'll try to answer as many questions as possible. All right, so if we can bring up our overview slide, I just want to touch on a few points before we jump into our discussion. First, probably many of you know this if you're waiting for a kidney or have just received one recently, close to 120,000 Americans are on the transplant waiting list. Nearly 100,000 of them are waiting for a kidney. And after receiving a kidney transplant, patients must remain on anti-rejection drugs. Also, you may have heard those called as immunosuppressant drugs for as long as they have their donated kidney. And these drugs weaken a person's immune system, making it less likely that the immune system will try to reject the donor organ. And these powerful drugs can also cause serious side effects. And as I'm sure we'll talk about as well, you know, there's issues with COVID as well and being immunocompromised also. So things like infections and other health problems are also common post-transplant experiences. More than 8 out of 10 patients experienced bacterial infections post-transplant. Nearly half had been diagnosed with cancer. 3 out of 10 had developed a fungal infection. Nearly 8 out of 10 patients had experienced depression or anxiety after the transplant. But none of this should lead anyone to believe that transplant is not really the best option for kidney failure by far and away. But let me bring in Silas, you to maybe elaborate a little bit on that. You know, we always say that kidney transplant's a new lease on life for patients. We're always very careful to say it's a cure, not a treatment. And we have here a few of the things on that slide that can happen post-transplant, but what are some of the other key things that people need to keep in mind once they've received the gift of life as a kidney transplant recipient, Silas?
Absolutely. Good morning. So as you mentioned, we talk about kidney transplant as a kidney replacement therapy, not a cure. And currently we recognize that transplant is the best replacement therapy for kidney disease because it affords people longer life expectancy and better quality of life in general. But as you mentioned, even with a transplant, as great as it can be, and they can last quite a long time, but there's always a chance that over time that kidney transplant may be lost. In addition, even though people have a transplant, they may not have quite normal kidney function. And so for some additional health considerations people have to keep in mind. One of the most important things people can do for their health over the long term is to focus on good quality eating and food intake. And so it's great that we have Carolyn with us today to talk about that a little bit more. In addition, it's important that people have their kidney transplant function tested regularly and that they keep up with their transplant providers consistently to have the best outcomes.
Great. Thank you very much, Silas. A question for Carolyn, and we've actually already gotten a question in the chat kind of related to this too, but healthy eating is still a very important part of life even after kidney transplant. Everyone knows about it when you have CKD, when you're on dialysis, but I think there's probably a misconception that as soon as you're transplanted, things are right back to the way they were. What are some of the things that patients need to be aware of?
It's so important to have a well-balanced, healthy lifestyle and diet after transplant. And thank you so much for letting me be a part of this. And thank you for the shout out, Dr. Norman. But really, just having a balanced plate, right? Because after a transplant doesn't mean that maybe, you can eat some more potassium, but possibly not just as many potato chips and French fries, right? You want to look for those nutrient-dense foods, these immunosuppressant medications that we were talking about just earlier have some nutrition side effects, right? They can raise your blood sugar. So making sure you're choosing smart carbohydrates like those whole grains, complex carbohydrates versus the added sugars and the refined grains like pastas and things like that. Making sure you're eating a bunch of different vegetables and getting all those nutrients, and then trying to stay active as well, because you want to maintain a healthy weight. These immunosuppressant drugs can increase your weight. It's just, unfortunately, a fact of life, right? And then as we get older, that happens too. So dang it.
Thank you very much, Carolyn. And I know we're getting some questions, kind of with some specific questions, which we'll come back to in just a little bit. But I want to first turn to our real expert on the panel, who's Crystal, and she is living with this daily. Crystal, if you tell us a little about your kidney transplant journey. You're on dialysis almost 7 years before getting the gift of life. What was that like for you? And what is some advice that you give to a new kidney transplant recipient that you'd wish you had known?
My journey has been a roller coaster. I had just moved to a new city, and 4 months in, one morning getting ready for work, I felt weak and couldn't finish brushing my teeth. I had to sit down. And I thought it was an asthma attack. I thought that it was just this exhaustion. And I was going to take myself to the hospital and wound up having to call 911. And they thought I was having a heart attack. And I basically woke up in the ICU and was told that I was in heart and kidney failure. And that's when all the lovely testing began. I was in the ICU for a week and in the hospital for 6 weeks. And during that time was when I started dialysis. They put in an emergency port in my jugular and basically at first gave me dialysis in the room. And then I went down to the center. And during that time, my new nephrologist actually pushed peritoneal dialysis. He said it was kinder on the kidneys, and also said that the best option would be transplant. I decided, okay, I'll do peritoneal. And I did hemodialysis in center for about 3 months while we decided to do the PD, and also while my catheter site healed. And then we started training. 7.5 years later, I am here largely because he pushed transplant, and I went ahead and started looking right away. I'm fortunate because I sit in a place where there are several hospitals that do transplant. And based on my social worker's suggestion, I started with just one and then could figure out if I was going to go ahead and get on the list in other hospitals. That was the easy part, actually, because I was motivated and I did all the testing right away, was able to find specialists largely because they'd all been my doctors in the hospital, and did all the testing and got on the list right away. They backdate you to your first day of dialysis. And I then went on to get listed in other places, one of which was my hometown. I was anxious and annoyed because I had hit past the 4 to 6 years that they told me it would take. I think I was annoyed at 6 years and 1 day. That was probably where I was most annoyed. And my nephrologist basically suggested that with my hometown clinic to let them know whenever I was going to be home. And unfortunately, around the holidays, the chance of getting a deceased donor is going to be higher, just because of accidents and the like. And basically, December of 2018, the Friday before Christmas, I had already let them know when I was going to be in town and for how long. And as I was waiting for my ride to the airport, my hospital called and asked me if I was on the road yet. And then basically we kept in touch the whole time because they said they've got a match and I needed to go ahead and come to the hospital when I landed. I called my parents, made sure they were sitting down and not moving in the vehicle, and told them, and also told the person who was supposed to be checking my mail for a week that it was going to be longer. And I was prepared for 2 months, 6 weeks, 2 months. If everything goes great, that should be it. I was not so prepared for some of the hiccups that I had there. My last night of dialysis was the night that I got home and checked into the hospital. We did the surgery first thing in the morning. They were actually waiting for cardiac death of the deceased donor. And even then, we weren't sure, is this still going to be a viable kidney? And I was warned that they could look at it and decide that it wasn't a good idea. And so they said it was a go. 5.5 hours later, I woke up, and at the time was just kind of waiting for everything to really sink in and to happen. I was fortunate because my kidney woke up right away, and I started making urine right away. I had a catheter in and had the bag attached to me. They actually had me walking that night. And I saw my parents later that evening, largely because they had planned a welcome home party on Saturday, the day I wound up getting the transplant, but also to thank people who had helped donate to Durable Trust to help pay for some of the medicines and treatment and travel and the like. And so they were able to tell people, okay, we've got to go. You stay here and let everybody else who comes through the door know that Crystal got her kidney and she's in surgery right now. And so they came after they greeted a few people. And it has been a roller coaster. I was discharged within a week. I did come back for checkups twice a week at first and was getting blood work each time. We were just about to move to once a week when I got an infection and wound up back in the hospital. And I was in the hospital for another week. The way my hospital, which was U of R Strong Transplant in Rochester, New York, the way they did it was anytime someone who had had a transplant was in the hospital, they just got put on the transplant floor if they had space. And so having the same nurses that I had when I first had the transplant was really, really helpful. But that particular infection also wound up being a wound infection. We put on a wound vac, and I was back out of the hospital in a week. And they also had me on an IV. And so I had an IV machine and the wound vac that I got to carry around. And even though my immune system was weakened, it was recommended that I not, that while I was careful, I not restrict myself too much. And so my parents would take me out to breakfast, and usually at places that they told everyone and that I had had a transplant. So I got a lot of attention every place we went. And so the IV came off first. And actually infectious medicine gave me a little placard, and I got to ring a bell once I got the line pulled for the IV. It was on the wound vac for another couple of weeks. And it was a miraculous thing to watch and to have to participate in my wound care for. Then actually that came off. I was ready to go, and I got another infection. And this time it was actually a urinary tract infection. And that was actually my first urinary tract infection ever. That was, and actually I wound up with sepsis as well. I'm somebody who doesn't show a fever. So one of the things that happened was that I had mentioned being feverish when we went to the ER. And that was a space where they went ahead and did a culture and found out that I had sepsis. So I was really, really fortunate with finding out I had sepsis. This whole time I was on the bevy of transplant medications, and they just switched my schedule to the hospital schedule whenever I was in the hospital. And that's another reason I was on the transplant floor, was to make sure that all the protocols were right, that all of my medications were provided by the transplant pharmacy. And that was not a great week in the hospital, but used to it by now. Once I got released, and was anxious to leave and get back home, it was basically about 5 months later. So I went in and received my kidney December 22nd of 18. And I did not get to go back to my home in Maryland until May of 2019.
Wow.
And I was ready. That was a rough space. But because I love my parents, but I'm an adult and I hit a space where, I had to take off.
Well, yeah, that makes sense. I mean, yeah, the parents are, it sounds like you had a really strong support system there to get you through that. And I know I can certainly relate with my parents about, going out to a restaurant and having your business told to everyone too, but they had a good reason to do so, it sounds like.
Yes, absolutely. They did.
And what a great present to get, for a homecoming party is to get a kidney transplant. And so glad that you end up getting that too. Silas, just a kind of a following up to what Crystal said, and it's something that I'll be honest, when I got into the kidney field, I didn't know happened very often. But she mentioned getting the call, going to the hospital, but then waiting, not sure if the kidney was going to be viable. How often does that happen, where a patient gets the call, they get to the hospital, and they're not able to actually get the transplant for one reason or the other? And what are some of the reasons for that might be happening?
Sure. So when we do transplant, it's a very time-sensitive situation. And so what we typically do when we think we have a good quality potential organ available for somebody, we'll ask them to come into the hospital so we can make sure that they're ready. And then at the same time, we're typically going out to recover the organ. And what can happen because we're doing those things simultaneously is sometimes we may arrive to recover the organ and there are changes in the health status of the potential donor. Sometimes we actually go to recover the organs and find out that those organs are not good enough quality that we want to transplant. And so it may be, and it certainly happens, that we bring people in a very disappointing way, nothing happens that evening. But it's all directed towards making sure that we can get people the best quality organ available.
Okay, great. Well, if you're just joining us, thank you for being here and being a part of Kidney Action Week, our current session, Life After Kidney Transplant. Again, you can join the conversation by typing questions and comments into the window next to or below the Facebook Live video stream, and we'll try to answer as many as possible. We have gotten some initial questions in, and we'll go ahead and get started. Carolyn, I kind of alluded that you'd be the first one, so here we go. Jacob asked, are there any supplements that are good to protect my kidney? And maybe as a side, if you want to interject of any that people should stay away from that put them at risk.
Honestly, eat food, not supplements. Supplements they're not regulated by the USDA or the FDA. We don't really know what all is in these supplements. Sure, maybe taking a vitamin like vitamin D or something like that, but you need to talk to your nephrologist about that because vitamin D and your bone health are all interrelated with the kidney. So I would stay away from supplements. If you are just bound and determined to take some type of supplement, you really want to stay away from anything that has any type of grapefruit extract or anything like that after transplant, because grapefruit does block the absorption of your immunosuppressant medications. Also, you want to make sure that it's being verified that the ingredients that are in the supplement are actually in the supplement. So like, because they're not regulated by the FDA or the USDA, somebody could say it has X, Y, and Z in it, but when you actually test it, it does not have X, Y, and Z, or it has some type of mold or fungus or things like that. Going to buying something that has a third-party vendor that has checked it and made sure, that's very important. You can Google online. I know that CVS only sells supplements now that are third-party certified, but honestly, eat food, not supplements.
Great. Thanks, Carolyn. Silas, this one is for you. There's kind of two connected questions, one anonymous, one from Tim. The first question was, when can I start working out after kidney transplant? And the second one, can I play sports after kidney transplant? So kind of related, but I'll let you answer.
Sure. So when people have a kidney transplant, it's an abdominal surgery. And so like any abdominal surgery, there's going to be a recovery time. We usually give people somewhere around 6 weeks before they start doing activities that are really, in particular, core activities, because it's important that the muscular incision that we make has enough time to heal. Certainly after transplant, we very much, building on what Carolyn was talking about, we very much encourage people to be physically active. Improving your cardiovascular health is particularly important. And people can absolutely play sports after transplant. If you think about it, many people may not realize this, there's a number of professional sports stars. There's some professional basketball players who are also kidney transplant recipients. And so you can certainly play sports, and you can play sports at a high level after transplant.
Great. Thanks, Silas. This is a very important one, a piece I want to get out of it. One more for you before I move on to a question for Crystal. Nicole asks, I just got a kidney transplant. Can I get the COVID-19 vaccine?
The short answer is yes. And the short answer is that we encourage all of our patients to be fully vaccinated, not just with the COVID vaccine, but with other CDC recommended vaccinations. For the specific question, your doctors may advise waiting for 1 to 3 months, depending on what specific medications you got at the time of transplantation, to improve the chances that you have a good response. to the vaccine, but the short answer is yes, and yes for all of our patients.
Thank you, Silas. And if you're looking for more information on the vaccine, we have a great FAQ on our website. If you go to kidneyfund.org/vaccine, you can check that out, and lots of other resources there as well. One of the things we do here at AKF is we do provide direct financial assistance to patients, and we helped about 7% of all kidney transplant patients last year with some form of financial assistance that helps them not go bankrupt, to keep their insurance. But obviously, there are still a lot of out-of-pocket costs. And Crystal, you mentioned that, right, that you had to set up a trust, and there's still out-of-pocket expenses you were dealing with. Do you want to talk about some of those and what patients may not be aware of that are involved when you get transplanted?
Sure thing. I was actually encouraged by my transplant center to go ahead and fundraise. Some won't, because at one point I was actually listed at 3 different places. One of them didn't necessarily encourage fundraising, but the other 2 did. But it's kind of to fill in the gaps for the most part. The medications, at least the prices that I was quoted, could reach $5,000 a month if you without insurance. And if you've been through the process, you know that they basically will list you but keep you inactive if you don't have insurance. They don't think that you have the means to cover it. And so my parents went ahead and they set up a durable trust, which was a way to go ahead and fundraise for me in a space where I wouldn't actually be liable for the taxes. So it's not actually my income. And Medicare covers 80%. And so you want to try to find a coinsurance that will take up the other 20. I lucked out when I first moved here because Maryland actually has a fund that is codified into law. And I believe it was in 89 that they codified it into law. And it's, and I forgot the name of it. But basically it covers the 20% that Medicare doesn't cover for kidney patients. And that was actually really, really just hugely fortunate that they had that. And it also meant that they would cover for the kidney transplant, they covered that 20%, even though I had the transplant out of state. They wouldn't cover extra visits, the 20% for the outside visits and follow up and that kind of thing. And so that was the space where we had to go ahead and use the funds from the trust, and that would work the best. But yeah, fundraising is important. Trying to make sure that you have extra funds just in case. The very last thing you actually want to worry about in any type of hospital situation is whether or not I can pay for it.
Yeah. Totally agree. I mean, and that is, something we see every day in the patients that we assist. And Rick had a similar question he was asking about regarding his share of cost of a kidney transplant. You have Medicare. Crystal makes a really good point, especially for those out of hospital visits, you've got to find a way to cover that other 20%. You can do that with state Medicaid programs in some instances. You can do it with Medigap plans, which are plans that cover that 20%. And now kidney patients can even get Medicare Advantage plans, which is called Part C. So there are lots of other ways to do that. You can find more information about insurance on our kidneyfund.org website. I would also recommend talking to your transplant financial coordinator who can help you work through that process as well. Carolyn, a question for you, and this is anonymous, but from someone in Northern Virginia. So you might actually even be able to help them directly since you're here local to us. But they're 5 months post-transplant, having a really hard time finding a renal dietitian. Their doctor was not able to help them find one. How can someone go about finding a renal dietitian?
Absolutely. First off, your transplant center has a dietitian, and you should be able to call them and set up an appointment. In a perfect world, right? The world's not perfect. So there's that option. You can also go to the Academy of Nutrition and Dietetics, or eatright.org. And it says like, find a dietitian, and you can type in renal disease, and they will show you a listing of all the dietitians around within a certain mile radius of your home that you've selected, and if they take insurance or not. Also, for the first 36 months after your transplant, Medicare will cover either all of the costs of the dietitian or some of the costs of the dietitian. So know that you should not have, if they accept insurance, know that you should not have to be paying for your visit to the dietitian. But eatright.org is the way to do it. Also, I think that there is some information on the Kidney Kitchen with the American Kidney Fund on how to find a dietitian.
Thanks, Carolyn. And that website is kitchen.kidneyfund.org, and you can find lots of recipes and other guides there as well. Silas, two, I think, relatively quick answers, I think. But let me ask these two questions. The first one is, how long does a kidney transplant last?
So the average deceased donor kidney transplant lasts somewhere around 14, 15 years. The average living donor kidney transplant lasts somewhere in the 16 to 20 year range on average, which is substantially better than dialysis. As we eat right and are active, that has a lot of potential to extend that time for us.
Great. Second question comes from JM. He asks, is it okay to have a half glass of wine with dinner after having a kidney transplant?
So everything in moderation. I'll certainly defer to Carolyn, but what we say to folks is just like folks who don't have transplants, you want to be healthy, which involves healthy eating, being consistently active. And so with alcohol, just like in non-transplant patients, we would say, everything in moderation.
Carolyn, anything to add to that about alcohol after a transplant?
Yeah, actually I do. We do recommend everything in moderation, and maybe even less after a transplant. That some of those immunosuppressant medications are filtered in your liver in the same place that alcohol is. So if you do things in excess, then it can overtax your liver, and then you could end up with liver damage. I certainly think that a half a glass of wine, maybe not every night, is an okay thing. But again, moderation.
Great. Thank you both. Crystal, a question for you. I have lots of anxiety about losing my kidney transplant. How do you deal with that?
Actually, what has helped the most is I'm in a lot of different kidney groups on Facebook, and there are several transplant groups. And being able to speak to patients who are kind of in the same space that you are in your head is really, really helpful. The other thing that's the most helpful is actually every so often somebody asks in those groups, how long have you had a kidney? And so the really great space is meeting people from all over the world who've had their kidney, and they've specified whether it was a live donor or deceased donor. One of the people was celebrating their 30th year with their kidney, and they had a deceased donor. And being able to just say to them how inspiring it is and gives me more hope for it. The other thing is I'm in therapy and actually on medication. And so therapy helps and it works. And I run every new med by my transplant team. They're always the first place that I check with. Even if I think that I'm gonna try a vitamin. They're the ones that I ask. But therapy and also the groups online have been a super help.
Thanks, Crystal. And, it's a great segue into our session that's coming up after this one about mental health and kidney disease. And, we will cover that anxiety piece and the importance of therapy. And, mental health is just as important as the physical health. And I hope everyone will watch that session as well. Question from Jacob, probably best for you, Silas, I guess. Does the anti-rejection medicine cause other problems, and what can you do about it?
Sure. No, it's a great question. So I think it's fair to say that in general, the medications tend to be well tolerated, but every medicine has their side effects. Most commonly, our medicines tend to raise blood pressures a bit, raise cholesterols. And so we routinely expect that we need to manage those things. There's a small chance that some people develop new diabetes after transplant. Again, something we look for and screen for and can help manage. Importantly, particularly in the times we're living in now, there's an increased risk of infection associated with these medications. And your transplant center, your transplant providers will help talk to you about the things you can do routinely to keep yourself safe and not infected. And so there are definitely some side effects. There's some risk of skin cancers and some other cancers associated with our medications, again, some of which we can help minimize. And so in general, well tolerated, definitely some side effects. We can usually manage them, in partnership with our patients. And so it's good for people to be aware and, educate themselves about these aspects so they understand kind of what they're getting into and how, we as transplant professionals can help them.
Hey,
Thanks,
Mike, can I
kind of
as well?
Please do. Yeah, Carolyn, please jump in.
All right. Yeah. So like Dr. Norman was saying, they can raise your blood sugar. They can also raise your potassium. They can also lower your magnesium and lower your phosphorus. They can cause you to gain weight. They can cause diarrhea. So there's a whole host of different nutritional side effects that that also can be looked at and managed through diet and healthy lifestyle and working with your dietitian and medical team. Your dietitian's got a list of different foods that are good sources of magnesium, different foods that are, good sources of potassium or a phosphorus, and you can work with your team to help minimize any of those effects as well.
Thanks, Carolyn. If anyone's watching and has any questions about whether or not you need a renal dietitian after transplant, I think Carolyn's showing you, you absolutely need to consider that too. There's so many things that kind of go into this. Silas, a follow-up question on the immunosuppressive drug question. Do you have to take them forever? Does the amount go up or down, or does it stay the same over the life of the transplant?
So these will be long-term medications for as long as your transplant is functioning. Being consistent with these medications is essential to have the best outcomes. In general, people are on more medication early after transplant than later on after transplant. So some of the medication doses do decrease, but there's going to be a steady amount of a couple of medications that people will be on for the long term.
Thanks, Silas. Carolyn, a question for you. What can I do to avoid foodborne illnesses?
Food safety, yes. One of my favorite things, wash your hands. Wash your hands, wash your hands, wash your hands. That is one of the most important things. So before you start cooking, wash your hands. After you handle raw meats, wash your hands. Also, wash your vegetables, wash your fruits. Even if you're not going to eat the skin of that fruit, so like an avocado or a cantaloupe, you're going to cut through that with a knife, right? And that knife, if you didn't wash the outside of it, is going to drag whatever bacteria through that raw fruit, and it's not going to be cooked, so it's not going to kill it. Also, cook all of your animal proteins to the proper internal temperature. That means no raw, like beef tartare or sushi or even lox, or like ceviche. It means medium well done meats. That doesn't, no like runny eggs. We want it to be cooked. So a poached egg with a hard yolk is fine, but a poached egg with a runny yolk is not okay. because these are all potential for some foodborne illnesses. You can go to the USDA website. There is a whole booklet on food safety precautions for people with suppressed immune systems. But wash your hands, cook your food when in doubt.
Thanks, Carolyn. Crystal, question for you. Someone is worried about keeping themselves protected during the COVID-19 pandemic. What do you do yourself to stay safe?
Well, first of all, I double checked with my team and to see what they wanted me to do. I did get the COVID-19 shot. They told me absolutely. When I called to ask if they wanted me to get the booster, they actually stopped me in the middle of my sentence to tell me yes. I was fortunate enough that I was able to do that right away. So I had my booster about 10 days ago. There's also the space where I still always wear a mask. To be honest, I started wearing a mask since I've been on dialysis and when we got towards that space where I was at the end of the waiting period, the typical waiting period, I was wearing a mask during flu season. I get my flu shot. I get my pneumonia shot. I'm up for shingles vaccination. I make sure I get all the vaccinations that I'm supposed to, because fortunately I'm not allergic to any of them. Wearing my mask is of the utmost importance. And I'm still mostly isolating. I pretty much only go to doctor's appointments and physical therapy. And then there's also the space that I wash my hands all the time. Especially when I get home, I actually make a beeline to the bathroom to wash my hands when I get into my house. And that also means I use a cane right now. That also means washing the handle of the cane too, to make sure that I didn't drag anything into my apartment with me. But that's really the space. I am nervous about it entirely, but I also have a strong support network who we do movie nights a couple times a week online, and that's honestly, it's minimal preparation, so that works just fine for everybody because nobody really wants to go out. But it's really about making sure that I am comfortable doing my best. And my best is wearing a mask and washing my hands and honestly not trusting anybody else because everybody's dirty and they touch everything.
Right.
And I noticed that actually right before transplant that and the funniest part is that I actually was on the bus and noticed it just again and made a post about it. And that was in January of 2020. And reminding all my friends to wash their hands because everybody touches everything and then touches their faces. But so, yeah, it's really in that space. I can do the most to protect myself when I'm wearing my mask and honestly, just only trusting the people I already trust to have been vaccinated or taken care. But even then, they wear a mask around me.
Thank you so much.
It's kind of
really,
in that space.
Really good advice. Silas, a question from anonymous person, but what happens if you miss a dose of your immunosuppressive drugs?
Sure. So being consistent with your immunosuppressive drugs and having good levels is really the best way to minimize having rejection episodes. We're all human. And so, over the time periods we're talking about, everybody's going to miss a dose somewhere in here. When you miss a dose, what you want to do is get in touch with your transplant center and let them know that you've missed a dose. And depending on which medication and what the timing's like, they'll give you some recommendations in terms of whether you need to go ahead and take that missed dose, whether you just restart with your next regularly scheduled dose. But probably most importantly, just highlights the importance of good communication with your transplant team.
Okay, great. Carolyn, a question we've gotten, and I've actually gotten this before in previous sessions that we've done and talking to people. But after being on dialysis for so long and being fluid restricted, I'm having trouble drinking enough water. Any tips?
Yes. Oh my goodness. I think that's probably one of the hardest things for our dialysis patients that have been transferred into having a kidney transplant. Just the normal goal is 2 liters of water or 64 ounces. I like to think about, I'm a numbers person. So in the morning, I started drinking 2 liters of water so that way I could, practice what I preached to my patients. So every morning I wake up and I like cold water. So I just have some tap water in my refrigerator and I fill up a 16-ounce cup of water and I just stand at my sink and I just drink it. And then throughout the day, I have a 32-ounce cup that is, fun colored and has a straw because straws make it easier for me to drink things. And I drink that throughout the day, if not one, or if not more than one, right? And then when I get home, I always drink another 16-ounce glass of water just to cover my bases. So having a plan, that's the thing. It's knowing what's going to work for you and having a plan. Maybe you want to drink 8 of those little bottles of water, right? Or maybe you just want to have 2 big old 32-ounce glasses, or maybe you have one of those really big water jugs that hold 64 ounces, but you just know that no matter what, you have to get through this and maybe tracking it along until you get into that habit. But it's all about getting into a habit that works for you and choosing water, not other beverages.
Thanks very much.
Silas, can I add to that?
Please do. Please.
My center actually put me on 3 liters a day. But what I did was I bought a liter bottle that had hash marks. And it sounds silly, but I actually set alarms for every hour to remind myself to drink more water. And basically with the liter bottle, it was easier to just say, okay, I go through 3 of these. That's what works for me. And that's what I do is with the routine, I set my alarms so I literally have, I think it's 14 alarms because from the time I wake up throughout the day. And I also try to make sure that I drink 8 ounces every time I take my meds too. So that's a built-in 18 ounces when I take those as well.
Thank you so much. Silas, question for you. What are some of the typical tests that take place after kidney transplant?
Sure. So after kidney transplant, we want to make sure that the kidney's doing well and the people are doing well in general. So there's going to be a number of blood tests frequently early after transplant, and then they taper down over time, as well as urine tests to make sure everything looks good. Periodically, there may be ultrasounds of the transplant to make sure that it's working well. And periodically in our center, we also will do needle biopsies of the transplant to look at the transplant tissue. Again, as one more way of just making sure the transplant's doing well and giving us an opportunity to address issues before they become a problem. Those are really the main sets of tests that are typical following transplant.
And Silas, I know there's some newer tests out there too, donor-derived cell-free DNA and some others too, which are growing in popularity in some cases. Can you talk about those? And if you're interested, I'm sure our team can put up. You've even done a blog post for us on that. So if you could talk a little bit about that.
Absolutely. So I think one of the really exciting things in transplant now is that there's new tests and new technologies that are helping us better manage and take care of patients with transplant. One, as you mentioned, is what's called donor-derived cell-free DNA. And essentially, these are tests that can tell the difference between your DNA and the DNA of your donor organ. And based on levels, we can pick up early signs of injury to your transplant before your numbers might change. And so this is a great way to be proactive with surveillance of patients, pick up potential problems before they cause a lot of damage and help take care of folks. And in some cases, they may help individuals either avoid having a kidney biopsy because we can confirm everything's okay, or give us heads up that a kidney biopsy is needed, even though people's numbers appear to be looking okay. So I think some exciting new technologies to help us just take even better care of our folks who have transplants.
Thanks, Silas. And I'm glad to say the American Kidney Fund actually has a program that helps with out-of-pocket costs associated with those tests as well. I'm sure I can ask my team to put that up on the Facebook page and in the link, but you can also find the information on our website at kidneyfund.org as well. Well, we are coming up on Thanksgiving and other holidays, and we have a question from someone, trying to see who asked it or if it was anonymous, from Jacob. Thoughts on holiday eating? Why don't I start with you, Crystal, and then I'll come back to Carolyn.
Moderation, and basically paying attention to what I'm eating, trying to not graze too much, but also to just do things, take them as I can, and just watch all the different. There are a lot of traps with holidays, but it's easier if you do things in moderation. And I kind of always lean towards vegetables, and the more the merrier.
Great. Carolyn?
Yeah, absolutely. Moderation is certainly key to avoid the weight gain and things like that. However, we also have to think about food safety during these times, right? So there's a lot of potlucks. There's a lot of different opportunities for foodborne illness, honestly. So I think if you're going to some type of holiday thing, you're obviously, if it's family or friend related, then, let them know. Say, hey, I need to go through that potluck first, and you just get everything that you need at that one time. Maybe you even make 2 plates and you store it in the refrigerator, the second plate, and then you reheat it in the microwave. Or because what you don't want to do, because this also is like cold and flu season as well. So you don't want someone to be sick and sneeze into, Aunt Beth's potatoes, and then all of a sudden you have some and now you're sick. So, food safety is very important when trying to tackle these. So just talk to the people you're going with and let them know that, hey, you've got some issues and you might be bringing your own food, or that you need to go first.
Yeah.
Great. I think we have time for one more question before we jump into final thoughts. Silas, this one is for you. You've done work at the University of Michigan for HIV positive patients and getting transplants for them. At one point, they would have been considered a non-ideal kidney. What are some considerations people should think about if they're considering a non-ideal kidney, and what does that even mean?
Sure. So I think the most important thing for people to keep in mind is that in general, transplant is going to be better for them than dialysis. There's a wide spectrum of kidneys, and we do our best to try to stratify those kidneys based on our expectations of how long they're going to last. Each of us as individuals are a little different in terms of our expected life expectancy, what other medical diseases we have. And so one of the things your transplant center will do for you is to try to get, in this case, a kidney that's good for you, that's going to do well for you, do better for you. And that may not be the same as the kidney that's going to do well for someone else. When we talk about some of these less than ideal kidneys, which may be from people who are older, who had some medical diseases, it doesn't mean they're bad kidneys. It just means they may not be young, perfectly healthy kidneys, but those kidneys can do very well for people, give people a long transplant life, free of dialysis. And so talk to your transplant center to get more detail. But even these so-called less than ideal kidneys can really be, transformative for people.
Perfect. Thank you so much. Well, what a great discussion. And thanks everyone for the questions. I think we got to almost all of them. If you're looking for answers, you probably find most of the answers to your questions on our website at kidneyfund.org. But before we wrap up, I want to give each of the panelists a moment to share their final thoughts and the main takeaway that they want patients to know about life after a kidney transplant. And Crystal, why don't I start with you?
I guess the main thing that I want everybody to take away is that it is manageable, and that you have to trust your transplant team. And it is also important to make sure that you have some sort of social support network that will at least help you kind of manage your way and make your way through all of it.
Thank you so much. Carolyn?
Yeah, I mean, honestly, I think some really important takeaway points are, number one, take your immunosuppressant medication as directed as by your doctor. Number two, go to all of your transplant appointments. Don't skip, go. They are your team. They are your cheerleaders. They are here to support you. Three, stay in good nutritional health. That means maintaining a healthy weight, controlling your blood sugar, following food safety guidelines, and balancing your electrolytes. And working with your dietitian will help you do all of those things. And then, last but not least, when in doubt, reach out to your transplant team. They are here for you to help you succeed and thrive.
Perfect. Silas, I'll leave you with a final thought.
So I'll just build on what the other speakers said. To be most successful, this is really a partnership, a team between the patient, your support network, and your transplant team. And we're here to support you in all the things that Crystal and Carolyn mentioned. There's a nephrologist, there's a surgeon, there's a dietitian, there's social workers, there's pharmacists, all really focused on how can we make sure that as a patient you have the best possible outcome. And so good communication, consistency with medications, healthy lifestyle, again, can really be transformative and give people a great outcome. And we're just here to support that.
Thank you very much. Well, Silas, Crystal, Carolyn, thank you again for spending this time with us today and providing us with this information. There's so much more to talk about when it comes to preventing kidney and dealing with a transplant. And we can't wait to bring all of you back for more chats in the future. I want to thank everyone at home for joining us on a Friday morning and being here and sending in just really, really excellent questions. If you haven't already, you can follow us on Facebook or send us your email through our kidneyfund.org website. And you'll be the first to know about other resources like this. Our final session of this year's Kidney Action Week will be coming up at 12:30 p.m. Eastern, 9:30 a.m. Pacific, and we'll focus on the kidney disease and mental health connection, which, again, as we mentioned, you heard today, is such an important and often overlooked topic. So I hope you join us for it. Once we conclude this session, you will see a link for a quick survey in green below the video screen. Please take a few minutes to fill it out. Tell us how we did. Your feedback will be very useful as we plan future sessions. Thanks, everyone, and have a great day.